of all the people that ask me about the HIIT protocol, it's probably the athletes. I mean, they're the ones that get the most benefit out of it. So, oh my God, you know, it feels like I've been oiled from the inside out. So I suppose, you know, that's the classic line that I always look for with when the clients, you know, once they've had the treatment. Years of just thinking, how can I unlock this hip? Surely there's a simple way to go about it. And, you know, it was simply just, you know, there was a light bulb moment, you know, obviously working with some of the hockey players, you know, at the London Olympics and so forth. They're just coming in with this incessant gluteal tonicity, and it used to drive me nuts. Obviously it kills your thumbs at the same time. I'm thinking, surely, what am I applying the same sort of protocols to the, you know, the opposing muscles, you know, the antagonists? And, you know, simple as that. You work those adductors, all that gluteal tonicity would fade away. You know, they come back in, they go, I don't know what you did last time, but can you do it again? Identify these holding patterns around the hip. So primarily hip extension, you know, the hip abduction and internal rotation. And there's a series of muscles for each one of those restrictions that are the key restrictors. So all you've got to do is basically address those, and I show you the techniques on how to do that. I like to think of this as more performance therapy, so you're actually helping your athletes perform better. And for me, you know, it falls back into being, you know, proactive as opposed to that reactive. So, you know, you want to make your athletes work better, be more efficient. So this is one of these techniques that, you know, if you're working with athletes, or you're just dealing with people who have lots of lower back and hip problems, which is a fair chunk of most therapists out there working, I would like to think that this technique is going to be a cracking extra modality in your toolbox for sure.
No hip pain. The first time in 4 years.